I think people are finally starting to understand that Judeo-Christian values may not be as repressive as we once thought. The issue is how to be able to communicate that they are as effective. What I saw as a vision for my life was to do it with data. I don't quite have the logic skills to be philosophical, as some of you might understand as I present here today, and so I ended up crunching data through my careers. I have fallen in love with the book of Numbers in the Old Testament and have developed, of course, a devotional guide for you if you're interested in this, and free with my life story and picture on the front as the final number. What National Institute for Healthcare Research is about is to really get out to policy people and the media that spirituality and religious commitment has been neglected and mishandled, and is actually quite beneficial socially, mentally, physically. It's also actually, we've done reviews showing it's been neglected in the media also. We did one published on television where we found less than 1% of anything on television was about religion and spirituality. Which is quite amazing given we have 40% of the U.S. population, 30 to 40% that are in church, synagogue, or mosque on any Sunday or Saturday of the week, and about 50% think it's very important, and particularly when they face medical problems. They will either pray or turn to some form of God, even if it's of their own making. So it's fascinating that the media has somehow neglected this, as has the research community. I have, if you want to get some of the things that I'm going to talk about today, all of what I'll be referring to are published in peer-reviewed journals. I am a rigid, concrete physician, and so the dangers that come with us is we try to refer and emphasize stuff published in peer-reviewed journals. We find other fields that's not so critical, but for us MD types it is. And we have material back there. If you want to get it from National Institute for Healthcare Research for a suggested donation, along with a book of Numbers devotional guide, you can get this order form in the back. We have both one where we walk you through the data and give you the context of the research, the clinical research field. Something when you look into research, you often can't get the context, and it's not hard because there's so little research to get the context, so we give you the context, and we also give studies that are almost impossible to find if you ever try keywording for them. We have found about 200 published studies that include religion or spirituality. Why is this relevant? Because is when you try to deal with ethics from a Judeo-Christian values side, you find you are the most politically incorrect institution or dinosaur that has ever run on 2, 3, or 4 legs. And so when you make the case that it's been neglected and that opinion is not based on data, if you're a data-oriented type, as I am, then you sort of have them in a very weak position. For example, let me illustrate with one of my more favorite curmudgeons of mental health, one of the more infamous mental health professionals, and what has been said about religion. And this is Albert Ellis. This was in Free Inquiry in spring of 1988, or rather, not 1888, but 1988, very recent. And the question was, is religiosity or religious commitment pathological? And Albert, in the spirit of David Letterman, gave 10 of his favorite reasons. He didn't quote David, I did, so I deserve that cite. Why religion is pathological. And I assume he has the data for this, but what he said is the religiously committed have poorer self-interests or love for themselves. That's 1. 2, I'm sorry I don't have the video, okay? 2, they're much more poorly self-directed, either more dependent, codependent, of course, or masochistic, thank you. 3, their care for fellow persons and social concerns is not there. They actually, despite the data that shows the greatest amount of volunteerism is by the church, or by the religiously committed, by the way. That's what the data says. About 60% of giving to public works is by the church, synagogue, or the religiously committed. And about 40% to 50% of the services are by the same. Excuse me, but we don't need that data right now if we have opinions. Fourthly, the religiously committed, if we have opinions, why listen to the data. We don't need that stuff. Fourthly, of course, the religiously committed are more intolerant. And fifthly, they're more inflexible. Thank you. They're not. Sixthly, risk takers. And of course, they can't handle ambivalence. All things have to be either, that means they're rigid, either one color or another's, and there's no grays for them. And finally, of course, if you're religiously committed, you are at risk of losing your ability to think scientifically, according to Albert Ellinger. You no longer can think scientifically if you become religiously committed. I think it's an illustration that religion and science have long been perceived as holding two opposing worldviews with limited commonality existing between them. While science has been perceived as factual, empirically verifiable, and clearly delineable, on the other hand, religion is portrayed as ephemeral, subjective, also ambiguous and squishy. Indeed, the belief that religion and science are inharmonious has become so deeply ingrained that our august national body, the National Academy of Sciences, nice building, by the way, in Washington, D.C., issued a resolution as recently as 1984, that's again not 1884, declaring that get this, religion and science are mutually exclusive realms of human thought, whose presentation in the same context leads to misunderstanding of both scientific theory and religious belief. Of course, they have the data for that. We finally have two issues that self-destruct each other if put in the same mix. While the scientific community has been slightly uncomfortable, that's an understatement, with the idea of merging the spheres of science and religion, recent research has shown that religion can indeed be studied empirically with objective measurement, at least in the clinical sciences. Furthermore, when religion has been investigated scientifically, religious commitment has often been found to have positive, I'll say that again, positive, beneficial clinical effects, either in association with or as outcomes, and they predict enhanced mental and physical health outcomes. Let me start with well-being. Now, according to Ellis, you're in problem if you become religiously committed. You are now going to be wearing your cross wherever you go. It is a burden. It will cause you duress, problems, and of course your mind will close to all more thinking. You will not be a truth seeker, you will be a lie seeker, so to speak. Well, what's there in terms of the research? At least you could say denial is good, given Ellis's point, because religious people, according to the research, have much better well-being. They're more satisfied with life. They have better marriages. They deny all over the place. And matter of fact, these people, despite the myth that, of course, that if you're rigid and inflexible, you're going to have worse sex, the research shows that religious people have better sex. God is obviously screwing up the data again. Don't let God get in the computer next time, all right? Finally, they have much lower rates of divorce, and if you think divorce has no fault, you haven't been around for long, although 50 of the states think there's no fault, because when you look at the consequences of divorce, you understand why it says in the last book of the Old Testament, God hates it. There aren't many things that God says so clearly that is despised, but that is one. Because when you look at the clinical consequences of divorce, they're staggering. Increased physical disorders for women, men, and children. For men, it's like smoking a pack of cigarettes a day the rest of your life. Increased all cancer mortality is increased so much. Psychiatric disorders are increased tenfold for separated divorced men. Increased psychiatric disorders for women and children. Increased drug problems for women and children. Increased alcoholism for men and women. Increased healthcare use for all three groups. Increased teen suicide for children of divorce. Decreased educational status. Decreased economic status for women and children. And yet, Dan Quayle was right. He wasn't just right about the consequences for children when it was written about in Atlantic Monthly. It's also for men and women. They're staggering about divorce. And yet, Scrabble, we're going to take the divorce word out. In the LA Times, it's no longer a politically acceptable term. We're just going to ignore it That's a nice way to deal with it. Who's got more of the denial problem is my question. At least we have the data on our side. Now, let's flip to the other side. Okay, we're looking at well-being, let's go over to the stress side. Well, given what Albert Ellis said, these people obviously should be under more stress, and they're lying about their well-being status. Sorry, they have lower rates of stress, and even when they have equal stress, as a study that David Williams and I published, what you find is over time, if you are going to church, you will have lower rates of psychiatric disorder if you are just a church attender. Just a church attender. That's a simple, too simple, in my opinion, way to look at this variable. To me, we really need to begin to look at both the people who are committed in their faith or their religion and are also spiritual, where it's alive and vital. Because most of our colleagues in the world that isn't religious always remember the anecdotes, as many of my mental health professional colleagues, of the people that are religiously committed but not spiritual, the hypocrites, the nasties. Okay, but we need to begin to understand that there's both religiously committed who are spiritual and they're religiously committed who are not. And there may be spiritual people who are seeking and are not yet religiously committed. It's a nice, simple way to characterize this. But no matter what, the religiously committed, that's the way the variables are used in the research. You can't find spiritual variables yet. Religiously committed have lower stress and have all these well-being benefits. In addition, when you turn to suicide, not surprisingly, in teen suicide, they have up to a 4 to 5 time risk reduction in terms of suicide. Again, just going to church. You can be going to church in adolescent, writing notes, asleep. That doesn't say, were you asleep when you were in church? Were you writing notes? Okay, were you under the pew? Did you have too much communion? That's not what's asked to these attenders. All it is are they regular or weekly or greater? Very interestingly, that what they have found is there's a good reason for this. The religiously committed in studies that I'm citing right here, they have fewer suicidal impulses, not surprisingly. It's a less acceptable alternative to them. If you're a mental health professional and you have to deal with suicidal people, I know I'm always relieved at night if I'm talking to a religious patient and I say, and what does God think about suicide, or what do they think, and they tell me God would never want me to do that. I can rest easy. When they say, I don't know, then they don't have any God in their life, it gets a little scarier if you're a mental health professional. You have to examine more closely, make sure the family's in support. With God in support, life is easier when it comes to suicidal ideation. Also, when it comes from a religious perspective, the foundational religious beliefs in an afterlife, eternal justice, and the possibility of condemnation, that's probably as ethical as I'm going to get during this talk, are all help to reduce the appeal of potentially self-destructive behaviors. It's a little scary when you don't know how big God is to kill yourself and then to face God. I mean, that's something that these people have to deal with in terms of suicide. If religion can reduce the appeal of potentially self-destructive behavior as suicide, could also play a role in decreasing other self-destructive and policy relevant. I'm not talking about small issues. I'm talking about some of the hotter, politically hot, in my town, issues of the day that continue to spiral upwards and are continued to written in the media and which still concern our society. We have suicide. We now have drug abuse. When this question has been examined, that is, does religious commitment play a role in drug abuse? In the published literature, the overwhelming response is yes. When Gorsuch and Butler in '76 conducted an early review of the drug abuse literature, they noted that religious commitment seemed to have a protective effect against drug abuse. Whenever, I'm quoting, whenever religion is used in an analysis, it predicts those who have not used an illicit drug regardless of whether the religious variables defined in terms of membership, usually a very weak variable, just saying I'm affiliated. It still predicts that they're not using. They may not even be going in this case, whether it's active participation or even religious upbringing or the meaningfulness of religion. It's a very powerful variable, what they're saying here. We recently, John Gartner and I, updated that review. Again, every study that we found, 12 out of 12 that were published on this issue, there was a consistent positive relationship with religious commitment and lower drug use. Have you heard about this? Is this something that's going on out there about the good news about religious commitment? Nada. Not. Let's turn to alcoholism. Okay, paralleling the drug abuse study is not surprising. This is going to get boring, okay, for those of us who may have heard this before, or you know what the answer is going to be, okay? A relationship between religious commitment and non-use or moderate use of alcohol has been extensively documented. Again, about 22 out of 24 published studies that have been done. The interesting thing is there's so few published studies. That's what's interesting. By the way, I've developed a conceptualization on why there are so few studies. I have posited, and I feel I deserve some type of award for this, which does not speak to my humble spirituality, but that's okay. I'm an Episcopalian, so, you know, it's not my problem. But I really feel that I have documented that the first anti-tenure variable that we have discovered is religious commitment. That is, if you want to study something that will move you from full professor to associate professor, which is new. I mean, it's a rather liberal thing to do. Study religious commitment, and you will have a shot at being, you know, regressing back through the anti-tenure effect, and you can see what's beyond zebra. That is, when you move back to teacher, what's on the other side of the coin. Okay? Furthermore, let me get back to alcoholism. It does that to me every time. Furthermore, a relationship between religious commitment and the non-use or moderate use of alcohol has been extensively documented. Most interestingly, Amatang and Barr found that whether or not a religion specifically prescribes against alcohol use, those who were active in a religious group consume substantially less than those who are not active. When you look at other policy-relevant, risk-taking behaviors for teens, you find the same thing happening. Search Institute in Minneapolis has found that whether you're talking about premarital sex for teens, drugs, alcohol, teen depression, school dropout, family problems, school problems, friendship problems, you find church-attending kids are at a risk of these problems, area after area after area. 50% to 40% to 30% of those kids who are not going to church despite the simplicity of the variable. Again, I brought that up several times. What I'd like to see are people that are committed in their faith, who have been doing it for some time, where there is an active play out of their altruism, that they're giving and they're involved. There's a devotionalism where I can look at how frequency they are praying or they're reading Holy Writ. That's what I'd like to see. Because when you see in the U.S. population, there's 30 to 40% that are just attending church, synagogue, or mosque. There's about 10% who have this rich development of their spiritual lives, where I think you'd even see more mental health and clinical benefit. I'm sorry about that, Albert Ellis. Now, if you move to health, you find the same thing, but there's just fewer studies. Jeff Levin has looked at the 8 studies on hypertension, 8 studies, all of them showing the religiously committed have lower blood pressures. When you start to talk about a blood pressure drop of 3 or 4, you're talking about something that might 3 or 4 millimeters Hg of mercury. You might be talking about something that has a person's on drugs or not drugs. If you're talking about its effect in the U.S. population, you might be talking about a risk reduction of 20 to 30% in cardiovascular disease. Does this have economic effects? Yes. It's just that we tend not to think in this policy-relevant way. We've looked at other studies. We did a hip fracture study published in the American Journal of Psychiatry, and what we found is that the women who are religiously committed, if God was important to them, that's all they said when they were attending church on a regular basis. When they had a sudden hip fracture, they walked, and now they're leaving the hospital. They walked farther at discharge and had lower levels of depression, which has long-term implication in terms of their success. Randy Bird's study, which is getting as much interest, that randomized prayer study, you do not see the media picking up studies in 1987. That is the past for the media. That is getting a lot of attention because of the openness and the hunger for our society for spiritual and religious issues. The point is they don't trust us, and what we need to do is communicate in means they trust. And like data, or however we can, to use the credibility that we can. St. Paul says something very nice: I become all things to all people, so that by all means people might open up and begin to discover these things that are good news, like data like this. So remember in the book of Proverbs it says, if you do these things, my daughter, my son, you will have a longer life. Right. I mean, can we test this? Yes, we can. I'm in a field known as epidemiology, and we look at survival or mortality, or there's other terms that are used, all right? Now, the nice thing about this to an epidemiologist, if you really want the gold standard of whether something should be studied, you ask the question, well, do people really live longer if there's a difference in this variable? Well, you know what? They do if they go to church. In about 13 out of 14 studies looked at, people live longer. But given it's our first identified anti-tenure factor, of course no one else wants to study it, until they're either an identified agnostic or atheist. By the way, I've been thinking of giving up the faith, because if I acknowledge that I have a spiritual commitment, I'm at risk of being biased. There's a slight double standard that we come across when you study this. So I always do find that admitting my Episcopalian heritage makes it much easier for me to be in the group of atheists or agnostics. So. Also, we have found coping with chronic disease makes it easier, that there's cost savings in terms of these outcomes also. Whether it's mental health or health, this is a factor that is beneficial. I think I've made the case. Now, let me get back to Ellis's point. Bias can be most intense in areas of strong emotion and controversy, such as the clinical interpretation of religion. Thus, an important issue that might need the most objectivity could unknowingly be the very issue interpreted with the greatest subjectivity. In other words, according to people's belief and bias, and not unaware of the published data. Given the long-standing popular belief that religion and science have little in common, one wonders what kind of influence such an assumption could have on the treatment of religion in scientific research. Stan Jones, in a magnificent piece just published in the American Psychologist, March of '94, addresses the issue of religious bias by saying, even if we think about our religious beliefs as biases that we bring to a psychological science and practice, we must come to realize first that such biases are intrinsic to our professional activities, in that it is our biases that allow us to perceive and understand anything at all. And second, that the most limiting and dangerous biases are those that are unexamined and hence exert their effect in an unreflective manner. Building on that idea that the most limiting and dangerous biases, which are those which are unexamined, the rest of what I will say will look on the assumed belief that religion and science are incompatible and has affected both the scientific as well as the religious sectors. Carl Jung once said, in science I miss the factor of meaning, and in religion that of empiricism. I will briefly examine whether, due to the bias against the bringing together of science, empirical science from my viewpoint, and religion, science has, that's my bias, has neglected religion, the factor meaning, and whether religion has neglected the science or the use of empiricism. And I'm restricting my comments to the clinical sciences. That will be pastoral care for religion, and that will be mental health, and to a certain extent health. Now, let me just briefly go through mental health, examination of religion, and sometimes in order to deal with issues of controversy or where people easily argue, get upset, get inflamed, or have their sympathetic system go into overdrive, it's easier to come up with something new where you limit bias. One of the things that we did, one of my probably more profound skills, is I'm highly obsessive. And in my career, I didn't know what to do with that, and I finally found an outlet for it, and that was we developed a very obsessive yet quantitative review approach to the research literature. Now, that is something that the research literature has needed in areas of social policy or in areas of intense controversy. That is, your standard review of the research literature tends not to have a method, although it reviews material with a method, scientific studies. What we developed is a review approach with a method. And that, although this gets a little, please go on with your talk, the point is this is where we've had a lot of impact in terms of a replicable review method in issues of religion. We've done issues of pornography. We've done other, we've just done one in corporal punishment where we found there was actually no studies on the issue, and yet there were position statements being taken by various policy groups. And so when you review and you look for peer-reviewed studies and you find out what they say and the quality of their research, it makes your life a lot easier. Given the systematic review, we looked at how frequently psychiatry looks at religion. Again, we looked at how frequently looked at spirituality, but we found very little concerning spiritual variables. What we found was 2% of quantified studies in psychiatry had a religious variable. It was usually a peripheral variable, not a central variable. Matter of fact, the reason I came up with this approach is because I tried to find where it was a key variable, and I found 3 studies out of 2,400. 3 where it was a key variable. 1 was the Women's Red Book study, and 2 were of homosexuals. 2 were of homosexual populations. 1 where religion supposedly caused harm for them, and the other where it helped them be converted, the famous Mansell-Pattison study. Those were the 3 where it was a central theme. We had to look for any place in the research, given I'm highly obsessive and like to do things like that. It was a great outlet for me, and I didn't bother my family for 3 months. So when you also looked, what you found, given this eensy-weensy or diminutive literature, what you found is when religion was usually assessed, it was assessed really using the wrong variable, that is denomination. Now, denomination is not a difficult variable to measure. It's Protestant, it's Catholic, it's Jewish, it's other than these 3 religions, and none of these 3 religions. Repeat after me, that was not tough. When psychiatry looked at it, they had things like this: Polish Catholic, Italian Catholic, and Mormon. Didn't we forget about people who are Jewish? Did you know, and you would see these odd combinations and permutations of things unknown. Maybe they were measuring spirituality, I just didn't pick it up. Denomination was oddly measured, and interestingly, the field's bias came out, because what you had is when it was just moderately successfully measured, and you added up the way the field looked at it, 40% of these denominational studies, and you added up the average, 40% were Protestant. Well, guess in the U.S. population, how many are Protestant? It's 60%. But psychiatrists don't see a lot of Protestants, especially conservative Protestants, because they're going to something called Christian psychiatrists, which I don't think psychiatry has heard of either. And psychiatry should hear about these people because they're making money and they see neurotics. Dr. Wilson used to see, DSM forgot about neurotics. Those are the people that blame themselves. All we have now people are character disorders that attack you. My mentor, Dr. Wilson, used to say, oh, let's treat a neurotic anytime you can. If you can spit on them, they get well. Well, psychiatry has forgotten about neurotics. They're going to see the Christian psychiatrists. Also, there's 3 to 5% of the population are Jewish. Psychiatry was getting an average of 20%. No one ever made a comment about this, by the way. They had much lower level of Catholics. They had a much higher level than the U.S. population. People had no belief, and there was no comment. And what you find is it's not denomination that's the key issue. It's religious commitment. It's attendance that makes the difference. Thankfully, for those of us who've worked in the federal government and are studying religion, I don't know why most of those people studying it are in federal government. Some type of paradox here. But what you find is a pluralistic variable. It's attendance and commitment that makes the difference, even measured in a simplistic way. So psychiatry wasn't studying this factor, and when they did, not surprisingly, given their little study, they were using the wrong variable, and most of the times it was a very beneficial factor. About 84% of the time, despite what Albert Ellis had to say, of the findings in the American Journal and the Archive of Psychiatry, this is a piece we published in the American Journal of Psychiatry in April of '92, about 84% of the times it was a very beneficial factor in the studies, whether it was an association or in a cross-sectional study or whether it was in a longitudinal study. Now, when you look at family medicine, a field that also is sensitive, having been in primary care research, it's a field that often is the front line of defense to mental health problems and needs. What we found there was much the same as in psychiatry. It was seldom studied, and when it was studied, it was often studied using the wrong variable, and also it was beneficial in the findings 80% of the time. That is, there was clinical benefit. Let me say a little more about that. What I mean by clinical benefit is if you had a finding and it had to do with religious commitment, higher religious commitment, clinical benefit would be it was associated with lower disease problem, whether it was mental disease or whether it was health disease. Harm would be that there was a statistical association with higher religious commitment and higher disease problems. And what we were getting in both of these was a very high level of benefit and a very low level of problems. Very consistent with what I talked about in the beginning. This is rather startling when you look at the importance of religion in the U.S. population and the lack of study of it, and also its relevance to political issues like economics. Howard Brody, known to some of you, wrote this in an accompanying editorial in the first family medicine piece. Research into religious issues and variables in family medicine might be rejected or undervalued because it seems wedded to the realm of anecdote or opinion. Ironically, the absence of a solid literature of religion in family medicine will assure that our knowledge remains in the realm of anecdote and opinion instead of progressing to an empirical assessment of beneficial, neutral, and harmful roles of religion among patients and providers. The most recent piece that I did working with Stephen Post, again known to some of you, was a piece published in December '93 in the American Journal of Psychiatry, where we showed what I illustrate, again using my simplistic epidemiologic approach. I call it positive bias. In the nosology, in the DSM-4, which is now used by just about all mental health fields as a diagnostic approach, since you get paid based on it, you have to use it. What you find is, in a glossary of terms, you find illustrations of pathology. There's a glossary of terms in DSM-3 and DSM-3R, and in that glossary, they will give, there's 100 terms that if you want to understand or read the psychiatric nomenclature, and that you're a layperson, you want to read it, and here are the 100 most frequently used terms. So if you look at them, you'll know what to do. So it's not an exciting thing to do. I would recommend it for those of you who can't sleep or are constipated, but otherwise I wouldn't recommend it. What you find in that glossary of terms are examples of pathology. You find 25% of the examples of pathology, you guessed it, are religious. Some of them blatantly, culturally insensitive. There's one example of a man in a Wednesday night prayer meeting who's in a public situation, repeats himself, says Jesus several times, and they talk about this as repetitive thinking. We published this thing, and I think that psychiatry is finally realizing some of the problems here. Stephen Post wrote, objectivity, the absence of all bias is of course an ideal that is never fully reached, because psychiatry, like any other discipline, has its own particular worldview, which is both historical and interpretive. However, because psychiatry is so powerful socially and politically, it should avoid the pretense of objectivity in controversial areas, such as in its nosology, and acknowledge that its interpretation of some phenomenon may be either reductionistic, maybe, or erroneous. My concern here, this is Stephen, is with unintended negative bias that stems from insensitivity and that can harm the therapeutic effort of the psychiatrist when dealing with religious persons. We have published a piece with Jeff Levin where we show that it's not only true in psychiatry, but religion is left out and neglected in psychology, in sociology. Remember, religion, isn't that a social phenomenon? It's being left out in sociology. It's being left out in the volunteer sector. Religion is a neglected factor, and I think I'm making a very strong case that religion is probably an anti-tenure factor. Briefly, I want to make a point. It's not all on mental health side. There isn't much research there, and I feel some of it must be laid at the feet of the pastoral care community, and the church, which has had an antagonism, I think, historically, to what I see as the Koine Greek of the day, that is data, where there can be consensus, and it is a peacemaking means, something that someone once talked about 2,000 years ago, of maybe dealing with problems that we have to deal with, like, is religion beneficial, or is it harmful, or should it be left out? What you find is 4 reviews published in 1979, 1986, 1991, and 1992, all saying that pastoral care, it is high time that you do research. It is high time that you do research. We published a systematic review. I will only highlight one of these. A systematic review of the 4 pastoral care research journals, and in terms of data, I am coming from this with a bias. Okay, I am coming to this, and I am aware that there's also theological interpretation and the importance of clinical interpretation, but I feel that it is long time, given these reviews after reviews published in pastoral care, that research be at least improved. When we looked at the 1,050 articles in pastoral care, less than 5%, if you know anything about statistics, it was almost a chance, a 1 in 20 chance that you found anything, any published study with any data whatsoever. There were two studies, one study that was a pre-post. One study with a pre-post. Very few of the studies had reliable measures. 4% of the studies had caveats about their data in their discussion. If you publish in standard medical research, you always caveat and do a Columbo and say, excuse me, we didn't mean to find this, here are the problems with our research. There's no problems with pastoral care research. Less than 20% had a hypothesis. If you don't have a hypothesis, it makes it hard to have focus in what you publish. Very few had reliable measures. Very few had reliable measures. One of the responses to our systematic review, I think it's consistent with where the field is, and that is that to publish using data is a typically, put in quotes, typically restrictive approach to what is legitimate research methodology, and that in essence we are a separate field or discipline. The problem is, if you're not publishing, you're not penetrating the clinical fields with the values of religious research. It's the pastoral care persons and the chaplains, not psychiatrists in the federal government, who are looked to in terms of the role of spirituality and religious commitment in the clinical domain. Stan Jones has made this point. Matter of Arlo Strunk made the point that when he published quantified studies in the journal Pastoral Care, he would frequently get letters of complaint. A quantified study was associated with a letter of complaint about using research. Stan Jones has made the point again, religious scientists will not function as scientists or scholars if they perpetually remain in a passive mode. I think that's what this is about, passing judgment on scientific paradigms by the standards of their religious presuppositions. I'm sorry, I'm a researcher, I won't get worked up again. Rather, they must constructively contribute to the progress of human understanding by putting their presuppositions to the test and seeing if they actually contribute to the progress of human knowing. Let me close. The apparent bias against religion in the mental health or health field, along with the apparent bias against science and clinical religious research, raises important ethical issues. First, science is assumed to be a domain that progresses through the gradual accumulation of new data or study findings. In any scientific field, one must examine new scientific developments and respond accordingly. Thus, if science informs us, the scientific community has an ethical obligation to examine and embrace this finding as potential scientific progress to be either supported or refuted in time with proper study replications. There's more depth to what I'm saying, but let me just take it as that. Thus, for these same reasons, the manner in which the clinical sciences have ignored religion in research is alarming, given the positive impact and role that society has for religion, and given the studies that I have reviewed in terms of physical as well as mental health and social benefit. Might the only explanation for the neglect of religion in mental health research and health research be due to the apparent bias against the blending of science and religion? I don't know. Likewise, clinical religious research has neglected to adequately assess religion in accordance with the principles of the scientific method, despite repeated research reviews recommending and demonstrating the need to finally do so. If science and human understanding are to advance based on the gradual accumulation of scientific facts, the religious sector seems to be seriously deficient in providing factual empirical evidence about the role spirituality and religion plays in health as well as mental health. Could this neglect of science also be tied to a similar type of bias, again holding against the blending of science and religion? Thus one is left with two perplexing ethical issues. I hope they're ethical issues. While health and mental health research seemingly neglects religion, religious research apparently neglects science in terms of data. While both may be examples of the way in which bias enters into the interface between science and religion, a larger ethical issue must be addressed. What is worse, to have data not change one's position in spite of it, or not to have data at all? Thank you.
I appreciate what you were saying, Dr. Larson. I'm a nurse and I'm real interested in spirituality from a Judeo-Christian standpoint, and I guess I kind of disagree as far as from the nursing literature that there is information out there with spirituality and religion, but when you start to look at it, it looks at transcendence other than, you know, that chair could be God or whatever. At our hospital...
Well, you never know.
At our hospital, we received $3 million for research, and I was interested in looking at psychological and spirituality with patients. And and I was talking with one of the chaplains, and I talked with one of the chaplains that was brought in to do research in the oncology unit from some money that was donated by a patient who had miraculously recovered from cancer. And that money was to do research in spirituality, until I said I was interested in looking at spirituality and seeing if there was a connection between those who had a faith in Jesus Christ, and then it was over. So I guess my comment to you would be, help me to understand how, as a Christian of the Judea faith, to do that research.
Your story is not new. You don't want to mention Jesus Christ, or you will be crucified. It will not even go through review committees if you had the term Jesus Christ. Some of the people here might let it go through. It's not an unusual story. Joe Strayhorn and I actually developed a measure where we left the JC word out, and where we look at religious commitment per se. The other thing to do is to get people like myself to talk with groups that are doing spiritual research and religious research, because I like Thomas Kuhn because I can understand. It's simple for me. But I think we're in a pre-paradigmatic stage where people are still putting down religion. They're still putting down spirituality. And so I think that we have to, and we're experiencing a double standard. And you need to kind of deal with it with a sense of humor. My patron saint is Saint Colombo, Lieutenant Colombo of the Los Angeles Police Force. And I think to deal with issues, excuse me, I didn't mean to find this, and we have a couple published studies here. Is the American Journal of Psychiatry important in the field of psychiatry? I mean, is this important? We kind of throw this in front of psychiatrists. But to do it wise as serpents and gentle as doves is something that the spirit of St. Colombo, that verse is personified by Lieutenant Colombo to me. And so we did develop a measure where we don't have the JC word, and it's actually in that notebook and it's also is published in the Journal of the American Community Psychology, Journal of the American Community Psychology Journal. And also to be sensitive to this, that what we will do is we'll first get the data. We'll have religious commitment or attendance at church or synagogue. We'll ask the question, and then we'll get their denomination. And then we will say, there is a difference here for the people who believe in this JC person, and then people are open to it. But until we have data like that, we will tend to say, let's look at spirituality and religious commitment. But it is thus far still very hard to look at spirituality. The nursing journals are, by the way, the best field looking at this. That is correct. But there still is very little data, and I think you'd agree with me. And they do tend to look at spirituality, but the problem is there's a very limited literature of spirituality. The literature is much more religious commitment. So, good point.
From an ethical standpoint, I think we as Christians have some soulmates in the Orthodox Jewish community. Has any research looked at the differences among the denominations within Judaism in terms of health and especially mental health?
The numbers aren't, if you're aware, there's a lot more of the people that are regular church attenders that are Catholic or synagogue attenders that are in the U.S. that are Catholic or Protestant than there are that are Jewish. And so it makes it much harder to look at that community. That is a problem. I'm beginning to work with a Hasidic community in New York. Why not? And so we are, and also with a Muslim Orthodox community in Egypt. We're beginning to look at both of these, which I think is important for us who might be Christian to begin to look at other communities. But the numbers are very small, and unless somebody's aware of studies that there are very, very few studies. In terms of soulmate, absolutely. I'm sorry, let me also respond there. There's a study that was done on Christian psychiatry that Mark Galliner and I did, and Mark had told me, he's never told me where he is. He's a famous alcohol researcher who's also looked at issues of cults. It's Mark who wanted the Christian psychiatry study to be done. And this Christian psychiatry group, this was published in the American Journal 91, is a very interesting group, because if you look at this Christian psychiatry group, they do pray with patients. And up until that time, we were getting suits. Christians were having problems if they prayed with patients. They do pray with patients. No, they don't pray with acute schizophrenics, okay, unless they're acutely schizophrenic too. But they do think it's important, and their values were very interesting. This group of Christian psychiatrists, 88% thought that sex between consenting homosexuals was sin. 88%. 99% thought that abortion was wrong. That's the highest number I've ever seen, and this is Christian psychiatrists, who are a very different group. Let me tell you, I know them. They're some of my best friends. So that Mark was the one who got into this because he told me first about that there was, like the underground Christian psychiatry network, which has come on ground and now is being marketed, there was an underground conservative and orthodox mental health underground, because unless they had an orthodox professional who understood where they were coming from, they got in a lot of problems because it was ignored and neglected in their treatment. So yes, there has been good relationships that we've set up.